very good day to everyone, especially to Dr. Haizi. My name is Arina Azizan, and together with me is Siti Asmawiyah, sitinornajehah, and Athirah. We are from Group B, and today we would like to present a case study of Parkinson's disease. Okay, we will start with the introduction of Parkinson's disease and proceed with the case study along with the physiotherapy assessment and physiotherapy treatment. The etiology of the Parkinson's disease is caused by a loss of nerve cells in the part of the brain called substantia nigra. So you can see over here. Okay, the nerve cell is responsible for producing a chemical called dopamine, whereby the dopamine actually acts as a messenger between the part of the brain and nervous system that help to control and coordinate body movements. So for the next is epidemiology. It is thought around 1 in 500 people are affected by Parkinson's disease. Most people with Parkinson's start develop their symptom when they are 50 years old. And then men are slightly have a high chances to get the disease compared to women. So for the risk factors of Parkinson's disease, environmental factors are responsible for the condition, and medication also can induce the Parkinsonism due to the antipsychotic medication, and progressive brain conditions such as progressive supranuclear palsy, multiple system atrophy, and corticobasal degeneration, as well as cerebrovascular disease, where the small strokes can cause several parts of the brain to die. Parkinson's disease is pathologically characterized by the loss of nigrostriatal dopaminergic nervations and cells located in other regions of the neural network. The disease may begin in the peripheral autonomic nervous system with or without the olfactory bulb, with the pathology then spreading through the central nervous system, affecting the lower brainstem structures before involving the substantia nigra. And such a widespread pathology makes Parkinsonism a very heterogeneous disorder, and a reliable diagnostic test is not yet available. But currently, the diagnosis is based on the clinical symptoms, with the criteria for a diagnosis requiring the presence of two of the following clinical features. The first stage of the Parkinson's disease is a very mild symptoms, where tremors on one side and postural changes are observed in this stage. And then it goes for moderate symptoms with facial modifications, where tremors on both sides of the body is observed, and proceeds with progression of disease, where imbalance of body and improper reflexes are observed. From this stage, sometimes patients having difficulties for rising from sit to stand, even though for walking also. Next is drastic change is observed, such as personal assistance is required even in simple tasks. This one more like patient nak minum air, patient nak suap makanan, a very simple task. And the final stage, stage 5, is an advanced stage with aggressive symptoms, where hallucination and spasm occurs on this stage. For the main clinical presentations of Parkinson's disease, it will be affecting more on the physical movement, where tremor akan berlaku even though limbs berada dalam keadaan relax or resting, and bradykinesia, which the movement is very slow, and from here we can see the shuffling walk. And next is the rigidity, where the stiffness and the tension in the muscles makes the patient difficult to move around and make facial expression. Although there's currently no cure for Parkinson's disease, so for the doctor's management, usually they will refer to physiotherapy and occupational therapy. If the patient have a speech or swallowing problem, then they will refer to the speech and language therapist. And for the medication, usually they will prescribe carbidopa-levodopa, where to control the involuntary movement, and anticholinergics to control the tremor. In some cases, if the patient is quite young age, they will go for deep brain stimulation. For other complications, they will have cognitive impairment such as thinking difficulties, depression and emotional changes, and sleeping problems. Sometimes it will affect their sleeping pattern, swallowing problems, chewing and eating problems, sexual dysfunction, bladder problems, constipation, and all the smell dysfunction, fatigue and pain. And for the physiotherapy goals, selalunya more to, if possible, we want the patient to become independent of themselves, because actually they have the muscle power but they don't have the coordination. Then for the gait. We will try to correct and improve any abnormal movement patterns and posture, and to maintain a very good breathing pattern and effective cough. And sometimes we need to educate the patient and the relative of the patient how to do the exercise at home, how to take care of them during at home. Usually for the home environment or assessment, OT will come into this in this picture, as well as the how to adapt a new condition to the daily.
Thank you to Arina. My name is Sitinornajehah. Now I will presenting about case assessment demographic data. Name Mr. Zax, RN B087809, age 54 years old, gender male, diagnosis is Parkinson disease, date of assessment is 26 April 2022. Patient clean and relative clean. Patient claim he feel hand shaky while taking a rest. Sometimes he also lost the stability while standing and walking. For current history, notice why he had a hand shaking and loss of control gripping. Patient immediately brought to check up and found out diagnosis of Parkinson. For past history, patient underlying of Parkinson disease since 2018 before the PKP. Past medical history, patient has hypertension, 6 years already and off medication already. IHD, no. TM also no, and family history, no family history of Parkinson. For social history, he is retired teacher, married with 5 children, living with wife and younger brother in single-story house. Toilet is squatting. Investigation result, MRI within 26 September 2018, finding abnormal at the brain, and CT scan also within 15 October 2018, finding abnormal at the brain. The medication is he take a levodopa and dopamine. Doctor management, doctor give medication and conservative management such as physiotherapy. For objective assessment, observation for general middle-aged man dependently using wheelchair assisted by his wife and daughter come to rehab department. For local observation, short of breath while talking and resting, tremor at the both hand, the eyes is rolling up and down, unable to concentrate one position like nystagmus, short step walking, like shuffling gait, and also slurred speech. External appearance, a wheelchair and walking frame with assistance dependent gait. Palpation, no edema, dry skin, and muscle atrophy.
Good look. Tak nampak dulu. Tak nampak. Boleh dulu. Tak boleh dulu. Tak nampak dulu. Tak nampak.
Territory for fitness level, which is taking heart rate and saturation oxygen. This patient pulse rate is 89 and saturation oxygen is normal, means in under room air 99%. But in blood pressure, patient slightly high, 179/90 due to dopamine medication intake.
Nama tu boleh hijau. Belum sebab kita ada dia masuk bank. Okey, banyak hijau. Hijau mati yang sudah lah.
Dia ke boleh?
Dia sama.
Dia sama. Dia sama.
Dalam sini.
Mau je sama. Pandai tu.
For the cognitive level, I asked a patient about his family history, his routine activity. Patient able to respond and answer all the questions about family history and routine activity. That show patient have a cognitive level in good condition.
Turun belah. Duduk depan dulu. Okey. Tengok ni. Jangan tu. Tengok kakak. Tengok ni. Kakak tinggi. Nak kat situ. Ni angkat ni. Itu juga ni tengok. Sekejap dah. Dah buat lembut tangan. Dan juga lembut.
motion for upper limb and lower limb is a good active full range of motion.
Jaga kuat. Tangan duduk mana? Duduk hijau dulu. Tangan kanan kiri. Kanan.
For muscle power, I assess a patient for upper limb and lower limb show that 3/5. This is because patient have a reducing in muscle strength and mobility. For assessment, from prior section assessment, the patient can recognize and has a good joint sense position.
Tu dekat jaga. Dekat jaga tu. Dekat. Ya. Apa dah ni? Belah ambil dah ni. Okey. Timer sikit lah. Itu kali.
In coordination assessment, I ask a patient to put a screw nut in the standing stick. The result show patient able perform the assessment very well. Finally, gait assessment. I assess a patient gait pattern. Patient walking in shuffling gait pattern, and his posture slump pattern posture.
Good morning, I'm Athirah binti Zalani. I will continue for physiotherapy treatment. For the first exercise, cardiorespiratory training.
The next one, cardio training, ask patient to take a deep breath. 1, 2, 3. For the next exercise, shoulder push. Right, okay, left. The next shoulder retract. Ask the patient to put hand at chest level. Ask the patient to move hand, to open the hand one by one. Like this.
Ask the patient to repeat the exercise, 5 for the right and 5 for the left.
1, 2, 3, 4. Next exercise is hip abduction. Ask the patient to move out the hip. 1, 2. Okay, next hip. 1, 2. Okay, next exercise knee extension. Knee extension. Ask the patient to extend the knee. 1, 2, 3. Okay. This way. 1, 2, 3. Okay. Next exercise for flexibility. Ask the patient to punch up. 1, 2, 3. 1, 2, 3, 4. Okay. Next exercise, leg stretch. Okay. Ask the patient to extend the knee and move forward. Touch the toes. Okay, good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Same for the opposite left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Balance training, unsupported, ask patient to lift up leg to right, okay, left, okay, right, okay, left, okay, second, unsupported, lift up, next, tendon release, right,
Next exercise is a full gait training. We can put patient on the treadmill. We can start with the slow speed and slowly progress, depend on patient progression. The use of treadmill, the use of biofeedback give better result in improving gait cycle length, duration of the gait, phase and swing phase speed, compare with exercise on treadmill alone. Coordination exercise is very important for patients to decrease their tremor and other motor symptoms. Next exercise for endurance running, we can use fluid cycling for the leg and hand for 10 to 15 minutes, depends on patient condition. This exercise can reduce bradykinesia, tremor, rigidity for the patient Parkinson.
Okay, this one is our reference. Thank you for watching our presentation.